Okay, basic facial part 2. We just got cut off. I don't know what happened there, random. Um, Getting ready to do the client consultation. So I'm going to meet with my client with clean hands, and hopefully we'll be able to proceed fully through this video now. So we are going to meet and greet our client. We are going to escort them to the work area. We're going to determine the client's preferences and assess the client's needs. We'll assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation like lice to prevent from safely performing the service. We'll assess the client's consultation form for any medications and products used within the last 72 hours and consult on any known allergies. We will consult with the client on any facial surgeries within the last 3 months and if the client is under a physician's care. We'll assess if the client is prone to cold sores or fever blisters. We'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. We will assess if they have had facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from any of those contraindications, we can move forward with the procedure. And there's so many details that go into that, so obviously you have to really go through those details. You're looking for anything that would compromise the skin or make an adverse reaction happen. So you just want to be very, very, very cautious when you're going through all of your client consultation form and information, and ask those open-ended questions so you know exactly what you're dealing with your client. So I'm going to give my client privacy and help her get set up. She would be disrobing from the waist up as far as just for that drape goes, so that her neck, décolleté, face are out. And then you've already made the facial bed, so she's going to be lying down on the facial bed. And she will get herself under the covers, which you're going to help her with. You've got your towel here at the head of the bed already horizontally. And then you're going to take that rolled towel underneath her head so you give her a little extra support at the neck area. And then you're going to cover up her décolleté also, give it a little extra coverage. And then I'm going to put on a hairnet because it seems to work a little bit better for us with the mannequin. This is the step where you'd be keeping the hair out of the face for you to perform the facial service. So she is then comfortable and ready for her facial. So what's going to happen now is I'm going to wash my hands and get prepared for the service. So my tray's all set up, so I would be going to the sink and I would be wetting my hands, and I would be washing my hands with that coin-sized amount of liquid hand soap. I'm going to wash them down to the wrists, and I'm going to wash the back of the wrists. I'm going to wash my fingers, and I'm going to wash the back of my fingers. I'm going to wash my fingertips and my nails. I'm going to wash between my fingers, and I'm going to wash between my thumbs. I'm going to wash my thumbs, and I'm going to wash my wrists. And I'm going to do all of this wash interlocking motion for a minimum of 20 to 30 seconds. And then once I feel like everything's washed, I'm going to give it a good and proper rinse underneath the sink. And then when I feel like I've gotten everything rinsed off, I'm going to grab disposable paper towels or a towel and turn the faucet off with the towels, dry my hands off, toss the towels in the trash. If they're paper towels, if it's a towel, I'll put it in a closed container until time for laundry. And then I'm going to grab my 70% ethyl alcohol hand sanitizer, and I am going to sanitize my hands thoroughly. Once my hands are sanitized, I will be able to begin my facial. And so what I'm going to do first and foremost is remove any makeup that my client might be wearing. And this is Sue, and she's definitely glamorous, so she does have a little bit of makeup on, so we're going to make sure we take it off of her. And just do what you need to do to remove the makeup. It might take a few passes, but you can do it. Everyone's different. And I'm just going to dry her off. And what I'm going to do now is do my initial cleanse of the skin. And I'm going to remove that initial cleanse. And this is when you would perform your skin analysis. So what you would do is you would be bringing over a magnifying lamp or woods lamp. And that's super bright. So you need to protect your client's eyes. So we would be bringing it over and turning it on. And it would be the time that you would be looking at, through the magnifying lamp, looking at your client's skin. And you would be looking for a variety of things. So you would be looking for anything from hyperpigmentation, dehydrated skin, flakiness, fine lines and wrinkles, excess sebum, maybe congestion in the skin, acne. You would be looking for any kind of like raised area, broken skin, anything specific maybe that she's asked you or he's asked you to look for, but you're also going in there with your skin professional's eye to try to figure out what benefits and services you think that your client would need going forward to achieve maximum beauty in their skin, maximum skin health, and also whatever their goals are, and then where you can see leading them with the support at home with the products that they need to be using on a daily basis to address any of the concerns that you might see going through this skin analysis process. So this is where you take the time to look everywhere. You're also going to be making notations in your either written client profile, or if you have a software system, you're going to be putting it in that. So it's super important that you take the time to spend the time here to get this right and make sure you feel like you've gotten a good analysis of what's happening with your skin. So if there is any changes with anything that you feel they need to be cautious about or concerned about, you can direct them to a physician, but also you're going to be able to really know their skin well and help guide them to get their maximum benefits from seeing you and also using their products. So take the time. Let's say the skin analysis is over. I've turned the light off. I'm going to take it away from my client, and then it's okay for you to remove those cotton rounds. And then we're going to move forward with cleanse number 2. So we're going to remove cleanse number 2. And then final cleanse now, cleanse number 3. and then you remove it. And once all of that cleanser is removed, we're going to tone. And I'm going to make sure that my little sprayer does not come into contact with my little squares. And after you cleanse and tone, the next step is exfoliation. And so I'm just going to get a little bit of exfoliator and I'm going to kind of spread it around on her face and neck area, and then I'm going to massage it in. Of course, we are always going to follow our manufacturer's directions. So, you know, you're going to avoid, of course, the eyes, the nose, and the mouth like we always do. So just be mindful of that. But what I'm going to do is I'm going to be massaging it in first. And we're going to say for 1 to 2 minutes is going to be our massage time frame. once you feel like you've gotten that nice and massaged in, I'm going to read to you what happens next. So, you will retrieve the steamer and turn it on. You'll position the steamer next to the facial bed, but make sure that it's facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, position the steamer 16 inches over the client's face and aim it at the client's chin for even distribution on the face. Allow the unit to function for 3 to 5 minutes. Then remove the steamer from the client's face. Return the steamer to its previous location for disinfectant. So let's review. So I don't have a steamer, so we're just going to kind of walk through this process. We would be bringing that steamer that we've preheated and set up as I read through in our getting our room ready for our client. So we're going to bring it over. We're going to make sure it's at the side of the bed, but that it's facing away from the client and that it's on and that it gets to that point where it's emitting that even flow of mist. Then we'll turn it towards the steamer part towards the client's chin, and then it can about 16 inches away, and then it can evenly distribute that steam up and across the face. And we would leave it there for 3 to 5 minutes. Obviously, we're doing the video, so we're not going to sit here without a steamer and go through that process. But just so you know, that's what we would be doing, and then we will turn it away from the client, push it out of the way, and then turn it off until we can disinfect it later. So it's not in any close proximity to the client when they finish the facial, and we're not worrying about it being still on or any steam or anything coming toward the client. So now we are going to remove the exfoliant, and I also don't have a hot cabbie, so what we're going to do is we're going to pretend like this is my hot cabbie, and we are going to get this nice wet towel out of the hot cabbie. It's hot, so we're going to shake it out. So we're going to test that temperature on my wrist, and it is comfortable. Then I'm going to test that temperature on my client's collarbone, and it's also comfortable. So then what we're going to do is fold it beautifully so that we can wrap our client's face, cover up everything but the nose, and then I'm just going to press it in. So that nice steamy hot towel can open up the pores and get us ready for the next step, which is extraction. So I just want to make sure we have it here for a good 20 to 30 seconds. It's going to cool down pretty quickly, so we won't be here for long. And once you've removed that exfoliant, you're going to dry your hands really nicely because you're going to put gloves on because it's time to perform extractions. So you need gloves on for that part. So you've got your disposable gloves that you're going to put on. And there's a couple ways. You can either use 2 cotton rounds soaked in astringent, and you can kind of work your way around and then toss it. I'm going to use wooden stick Q-tips, and I'm going to be using a single pair for every extraction soaked in astringent. So you just need to know that if you use a pair, you have to toss it as soon as you perform an extraction. So I'm just going to go in and perform a few extractions. She doesn't need a lot, but she does have some congestion around her nose area. So we're going to toss those, and we're going to get ourselves 2 more. Two more. And you don't want to do the extraction part any more than 5 to 7 minutes because it can be a tiny bit uncomfortable for the client. So we want to make sure that your client they can handle it for a while, but not for too long. And we'll just say that that's enough. I mean, she's done there. So you can throw all of those wooden stick Q-tips in the trash immediately. You should after each use. And then your gloves, as they come off, you can throw those in the trash. And then we're going to follow with toner. So you've exfoliated, you've done your extractions, and now you're going to tone your client. So I've got my cotton rounds, and I'm going to make sure my sprayer doesn't touch. It's just that extra step in that sanitation. It just never comes in contact with the little cotton rounds. And the good news is after you perform those extractions that the next step is massage. So she's going to be thrilled with that. So make sure when you're getting your massage product that you do get out enough to do the full massage. And the reason for that is you're going to spread out your massage product on your client before you start the massage. That way you don't have to leave, your hands don't have to leave your client during the massage, because this is the most relaxing part for them and they really want to be able to relax and enjoy it. You do not want to have to stop, start. That would not be a relaxing massage at all. So just take the time to get enough massage product on that initial application so that you don't have to leave your client during the massage portion in order to start something else or get some more product rather. And then you're going to remove the massage product. And then after your massage product is completely removed, you're going to apply the mask. And I'm going to use a brush to apply my mask. And of course, you know, same rules apply, following manufacturer's directions. And we're going to, of course, avoid the eyes, the nose, and the mouth like we do for everything else. And then, of course, you're going to follow those manufacturers' instructions for how long that you would leave the mask on. It could be left on from anywhere from 5 to 10 minutes. So just depending on what that is, what you're doing, we're not going to stay here for 5 to 10 minutes. We're just going to go ahead and remove that mask as if that 5 to 10 minutes has already passed. So let's go ahead and do that. So the mask has been on for 5 to 10 minutes and it's time now to take it off. then we finish with a toner. So once again, I'm going to avoid touching with my cotton rounds and my sprayer. And then we're going to apply her eye cream and her moisturizer. And I'm going to go ahead and apply like a night cream type situation, not an SPF, because it's totally dark outside. It's nighttime. She can go home and she doesn't have to wash her face after the service. She'll be able to go straight to bed. So I'm going to apply a little bit of eye cream, a tiny little bit on my ring fingers because they're the most delicate. I'm going to apply it to the brow bone and the zygomatic arch, lightly tapping. And then the moisturizer, like I said, she won't have to wash if we do this. We've already talked about the importance of sunscreen. We know all of that. So we're going to apply a nice moisturizer to finish up the facial service. And I'm also going to give her a little bit of lip hydration, of course, because we want to touch on all of the face. Teensy little bit of that before we leave. Who doesn't want that? And she looks amazing and she feels amazing. Let's finish up our facial service. And then you would be giving her privacy to get dressed back into her clothes and then to be able to come and meet you out in the client waiting room area. And let's talk about how we finish this service. So what you're going to do is you will go over your aftercare, any maintenance that you would recommend, appointments that you want her to book, obviously what she's going to be going home with that's not in her little aftercare kit that would be a priority for her to get today, some things that she was really concerned about that you can help support her at home, because remember, she's going to be at home every single day of the month. She's only with you maybe once a month or every 5 weeks or less. So you really need to make sure she's going home with the proper things. And then you need to go back to your room once you get her checked out and on her way to get ready for your next client. So you get her checked out, she's super happy and booked, and she leaves with her products. So you're going to go back to clean up. You're going to discard any single items that you haven't already, like maybe disposable cups, gloves, anything like that. If you have any implements, they're going to go into a closed container labeled to be disinfected. All of your towels, your sheets, your bedding are going to go into your closed container until it's time to do laundry. So that laundry container with the lid. Then you are going to identify a proper cleaning agent, read the manufacturer's directions, follow the manufacturer's directions for mixing and usage, and wipe down your workstation and area with that cleaning solution to remove debris. Then you're going to identify a disinfectant that is bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting. You're going to get some disposable gloves because you'll have to wear that for that. And you'll follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You will disinfect electrical equipment, store it in a clean area separate from other implements, and then you'll be able to take off those disposable gloves, throw them in the trash, and it is time to wash your hands to finish the entire service. So you wet your hands at the sink, you get that coin-sized amount of liquid hand soap, and you wash your hands together down to the wrists, and then you wash the back of your hands. You're going to wash your fingers and the back of your fingers. You're going to wash those fingertips and nails between your fingers and your thumb. You're going to wash your thumbs. You're going to wash your wrist. You're going to do all of that interlocking washing motion for a minimum of 20 to 30 seconds. Thoroughly rinse the hands underneath the water. When you feel like you've gotten that proper rinse, You can get your disposable paper towels or a clean towel and turn the faucet off. Dry your hands off with the paper towels, throw them in the trash. If it's a clean towel that's now dirty, you're gonna put it in the hamper with the other laundry with the closed lid until it's time to wash the laundry, and then you're gonna grab that hand sanitizer, that's 70% ethyl alcohol, and you're gonna properly sanitize those hands to finish. When everything is sanitized and dry, you will then be able to move forward to set up for your next appointment or client. And if you're going home, your room is clean and ready and fresh for you to start your day tomorrow. So that concludes part 2 video of basic facial.